Bismillah Rahman Rahim. Assalamu alaikum. Welcome into the second last episode of our series on diabetes mellitus and Ramadan. In the first episode, we discussed that why should we talk about management of diabetes in Ramadan fasting. Then in the second episode, we discussed the impact of Ramadan on physiology of a human body, its hormones, and its metabolism. In the third episode, we discussed how to stratify diabetic patients into high risk, moderate risk, and low risk regarding Ramadan fasting. High risk patients are those who should not fast. Moderate risk patients are those who can fast but under strict control and monitoring. And low risk patients are those who can fast without any fear. Then we discussed in the next episode the management of type 1 diabetes mellitus, how to manage adolescents and adults with type 1 diabetes mellitus. Then in the last episodes, we discussed management of type 2 diabetic patients. As said in the last episodes, today we shall discuss special populations. That what about pregnant ladies who are diabetic and if they want to have the Ramadan fast? And second, elderly people with diabetes and if they want to fast during Ramadan, so what about them? And in tomorrow last episodes, we shall discuss the complications in diabetic patients because of Ramadan fasting, the possible complications, what complications they can have. So today we are going to discuss special populations. Today is the sixth episode of our workshop on Ramadan and diabetes. And today we shall discuss the management of special populations of diabetic patients in Ramadan fasting. And these will include pregnant women with diabetes and elderly individuals with diabetes. So first take the pregnant women with diabetes. We know in Islam, all pregnant women have the right not to fast regardless of whether they have diabetes or not. So this choice has been given to all pregnant women. For those that do fast, expert support and guidance is needed in order to improve safety for both the mother and fetus. The potential risks of fasting among pregnant women with gestational diabetes mellitus, pre-existing type 1 diabetes mellitus, or type 2 diabetes mellitus is high. So a pregnant woman can have three types of diabetes. It may be gestational diabetes, who has appeared or diagnosed during pregnancy, and it is because of the pregnancy. Or it may be a pre-existing diabetes, it may be type 1 or type 2. It is recommended that pregnant women with diabetes not to fast until further research is available to support fasting. This is the medical point of view. As with all individuals with diabetes, there should be a pre-Ramadan assessment alongside individualized Ramadan-focused education of pregnant women with diabetes. There needs to be an increase in the rate of self-monitoring of blood glucose throughout the day, including before iftar, after meals, during fasting, and anytime there are feeling of being unwell. If uh, such women want to fast during Ramadan. Pregnant women that are fasting during Ramadan will need to follow the Ramadan nutrition plan, and the healthcare worker should provide this plan to them, as with all other individuals with diabetes, but also make further changes. They may need further changes, the high caloric diets, because now they are pregnant and their nutritional requirements they are increased. Caffeine, sugar, and salt should be limited, and the eating of fibrous foods should be encouraged. There needs to be a greater effort made to stay hydrated, and pregnant women should aim to drink 2 to 3 liters of water a day. That is between the iftar and the suhoor time. Many pregnant women will be treated with insulin to manage their conditions, but currently research on the best dosing regime is scarce. The IDF-DR guidelines have recommended insulin dose and blood glucose monitoring regime modifications to be aligned with that mentioned above, that is in our previous vlogs, for those with type 1 or type 2 diabetes. Now coming to the second special population, that is the elderly individuals with diabetes. Age in and of itself is not a good reason to categorize individuals as high risk for fasting during Ramadan. This is not the chronological age. This is the biological age, in fact. But rather it is the associated implications of old age that need consideration. So once again, don't be focused on the chronological age. This is the biological age. Elderly people, 65 or even 70, they may be in very good health, biological health, and even those 55 may be in a very bad shape. Elderly individuals are at higher risk of having comorbidities. We know that. These comorbidities can include dementia, recurrent falls, hip fractures, amputation, and visual impairment. These all have important implications on the safety of fasting during Ramadan. And these complications are high when it is elderly individual with diabetes. Likewise, many elderly individuals generally have a longer duration of diabetes and will also be more likely to suffer from diabetes-related complications, such as hypertension, hyperlipidemia, retinopathy, and neuropathy, among others. This graph is showing, this was the study conducted global survey by DAR, the 2020, that the green is those less than 65 years of age, and the dark blue are those who are more than 65 years of age. So when they compare, like hypertension, it was 45.29% in those less than 65 years of age, and it was around 67% of those 65 years are over. Similarly, hyperlipidemia was around 39% in less than 65 years of age, and it was found to be 48.23% in age group of 65 years or over. Similarly, retinopathy, it was around 11% in 65 years or less, as compared to 23% in 65 years or elder. Similarly, neuropathy was almost 20% in those less than 65 years, and it was around 29% in those 65 years or elder. Similarly, the nephropathy or chronic kidney disease was around 8% in those less than 65 years of age, and it was around 18% in those 65 years or older. Similarly, coronary artery disease, stroke, TIA, peripheral vascular disease was around 8% in less than 65 years of age, and it was 20% in those aged 65 years or over. Similarly was the diabetic foot problems. It was around 3% in less than 65 years and around 5% in more than 65 years of age. So higher the age, higher is the chance of complications. It is vital that pre-existing comorbidities and any history of diabetes related complications are identified by healthcare professionals during the pre-Ramadan assessment and risk stratification process. Importantly, healthcare professionals must also consider an elderly individual's degree of independence, as this is crucial in understanding what kind of support may be needed during Ramadan, such as with feeding. This is very important, taking medications, and checking blood glucose levels. So, how much support that elderly individual has got around himself or herself. The primary concern among elderly individuals is the risk of developing hypoglycemia during Ramadan. It has been found that the risk of hypoglycemia is increased among the elderly and may often present with neuroglycopenic manifestations in the form of dizziness, delirium, and confusion. These can all lead to periods of unawareness and hypoglycemia, which can be extremely dangerous. So, this is another point, and you should keep that in mind. Hyperglycemia is also an important issue and has been seen to be higher among the elderly than in younger individuals with type 2 diabetes. It is recommended that the individuals with hypoglycemia unawareness or a history of unawareness do not fast. They should not fast. A key component to avoiding hypoglycemia is self-monitoring of blood glucose, and it must be conducted frequently. The 7-point guide for self-monitoring blood glucose, which I have discussed in the previous vlogs, should be used as a guide and adopted. Moreover, medication doses should also be adjusted appropriately. Any dose adjustments that are made need to be set prior to Ramadan, ideally during the pre-Ramadan assessment. Ramadan-focused education also needs to be adopted and individualized to account for these issues. The specific guidance for the elderly with type diabetes include the following. What are these? Number 1, medication and regimes. Take care of these. Number 2, self-monitoring of blood glucose. Number 3, diet. Number 4, physical activity. Number 5, social considerations and community support. And number 6, to take care of risks of complications and awareness. Regarding medications and regimes, there should have been an assessment and discussion prior to Ramadan. You should choose medications that have a lower risk towards hypoglycemia. Make dose adjustments to lower the risk of hypoglycemia. And I've discussed all these modifications in the previous vlog. Regarding self-monitoring of blood glucose, there should be increase the frequency of you should increase the frequency of self-monitoring blood glucose when fasting during Ramadan than before Ramadan. So elderly individual, what frequency he or she was having for self-monitoring blood glucose, increase that frequency. Consider using a continuous means of monitoring blood glucose levels if available. Regarding diet, there needs to be an emphasis on staying properly hydrated, and this is very, very important, particularly in individuals prone to diabetes related comorbidities or complications. Must have an adequate intake of nutrients when breaking the fast. So tell them that they should have a good caloric diet. An individualized nutrition plan should be made prior to Ramadan and adhered to during the Ramadan fast. So tell them this will be your plan in the suhoor, in the aftari, and how to be sticking around this. Physical activity. Physical activity level should be curtailed, no doubt about that, but not halted during fasting hours. So this is very important. Activities should be planned ahead of time and thought of holistically, that is, in conjunction with nutrition plans and medication regimes. Then the social consideration and community support. Adequate support mechanisms should be in place to ensure that elderly individuals with diabetes wishing to fast receive support from family members, friends, carers, or community members. This should provide greater level of safety and confidence. Regarding the risk of complications and awareness, there needs to be an active effort to increase the awareness of symptoms of hypoglycemia and hyperglycemia. Symptoms and events should be documented to help with recognition. The effects of fasting in people with comorbidities such as dementia, impaired renal functions, cerebrovascular disease, and others should be seriously considered and discussed prior to conducting Ramadan fasting. What are the complications of diabetes when fasting during Ramadan? People with diabetes that have unstable macro or microvascular complications and choose to fast during Ramadan could exacerbate these complications, and therefore these individuals are classified as high risk. These complications may be macrovascular complications and chronic kidney disease, that is the microvascular complications. We shall discuss all these tomorrow in the last episode. So be with me to discuss that what the macrovascular complications and macrovascular complications can do, or what is the impact of Ramadan on the patient who is already having these sorts of complications. So see you tomorrow in the last episode of this workshop. Khuda Hafiz.